Tell us more about this booster shot. Do you think it will be approved for children that young?
I feel very confident that it will. And I'm looking at some different reports that are coming out today, and it's very exciting news in the scientific community. I mean, the bottom line is healthcare providers such as myself, our primary desire is to help our patients. And this gives us another tool in our arsenal so that we can fight this coronavirus pandemic, especially in these little children, because we've talked about this quite a bit over the last couple of years. Children, they're less likely to wear the mask because the compliance is very low because they don't understand social distancing as well. So vaccines, they give us that tool. And with the booster, I mean, this new study that came out is showing that in one group, we're looking at a 36-fold increase in the antibodies of these children that received this booster 6 months after they got their second dose. I mean, that's a lot more protection, and our children really deserve it.
With cases down, Dr. Quinn, do you foresee a problem convincing parents to let their children be vaccinated? And if you do, what can we do about that?
Well, you know, this is a challenge that I and a lot of my colleagues all over the country and all over the world face every day. I had a very interesting conversation with a mom yesterday because we do the vaccinations in our clinic. And the mom told me that she didn't want her child vaccinated because the baby has sickle cell, Dr. Quinn. We don't want my baby to get vaccinated. She has sickle cell. It could hurt her. And I said, ma'am, no. That's just the opposite. If your baby has sickle cell or any other medical condition, they need the vaccine more than anybody else because their immune system would theoretically be slightly compromised. And once I educated the mom on how the vaccine is safe and very effective, especially in her child, who she loves so much as she should, she was willing to get the vaccine, and we vaccinated that child yesterday. So we just have to keep putting that information out there so our patients and individuals will be empowered with knowledge so they can make an educated decision.
Dr. Quinn, one last note. What information do you have on this latest variant?
Yes, the subvariant, it's of the Omicron group. It's much more infectious. That's very scary. But the good news is it's not more virulent, meaning there's a higher chance you'll contract it, but there's a better chance you'll recover. But we still have to understand that there are a lot of people that are immunocompromised, such as our elderly and those with chronic medical conditions. That's why we have to do everything we can to fight this pandemic to keep the infection rate down as much as possible.
Dr. Timothy Quinn of Quinn Clinic in Ridgeland, thank you, sir.